no allergies, right?
No allergies.
Okay, so we're going to get you cleaned off here.
Okay.
Use some iodine. 1, 2, go the opposite way. Make sure no tiny little hairs on your back are getting stuck. And 3. Okay. As that dries, I'm going to put a sterile drape up here on you, which is lidocaine. Drop our lidocaine. Find our spot. Poke. And then inject as it goes in. Okay? As that's getting numb, I'm going to get my TUI needle. Okay? Find my spot. Right there. We're going to inject here. So we've got the TUI needle in. Okay?
Okay.
Pull this out. We're going to get our loss of resistance needle. Connect it here. We're going to advance this. Ooh, okay, there's our loss of resistance. I'm in your epidural space now. Then you'd have your needle set up right here. Pull this out. Put your needle in until it gets through 2 ligaments. You have a ligament on the outside of your spine and then a ligament in between your vertebrae.
Yeah.
Right? So once it's in between your vertebrae, it'll stay by itself.
Yeah.
That's how you know it's there. Make sure you're exactly midline. So if this is her back, go exactly midline. You don't want to be off center like this. You'll get in a vessel.
And you have to, is there a way to make sure that you get it, you know, insert it straight?
Yeah, so what you can do is once you're draped, you can feel your spine. Like come up like this, because it'll be draped up to here, so this will all be sterile. So you can feel your spine and like kind of work it down. Some people have scoliosis in their vertebrae like that.
That's what I was going to ask about scoliosis.
Yeah, or lordosis where their back's like pushed out like this.
So that changes the well, it changes where it's going to be positioned.
Yeah, scoliosis, it'll be like this. So like you'll have like that depression in your back, but the vertebrae will actually be over here. So you got to kind of like really follow
Feel
it.
for it.
Yeah. And then once you get that, so you got your TUI in, right?
TUI, what do you call
That's a
it?
TUI.
TUI.
If you look at the tip of that, see how the tip
Oh, yeah,
is kind of
yeah,
beveled
yeah,
up?
yeah.
The point of that is to take your catheter, once you think you're in the epidural space, which again is a potential space, that's part's kind of a big deal.
And they put that in.
Put this in. You need to know where your markings are. So that big bit here is the tip of the catheter. So once you go further in, you're going to be pushing the catheter into your back. You know what I mean? So you push, like I said, about 4 cc's.
And it actually goes up along?
Right.
Okay.
It's got that angle there, so it's going to be like that.
Okay.
Going up her back. Once that goes in, you push it in like, I don't know, like that far. Because you can always pull back. You can't advance anymore once you pull the TUI out. But you can pull back. So, you know, let's say this is her back.
I can use my hand in this.
Right. Here, go like this. I don't want to hurt you. Like that. Okay. So you would just do like this. Keep the catheter there. Real slowly pull the TUI off. Once you get enough that you can grab, you can just like that.